Geisinger is set to open a new care clinic in Shamokin Dam focused on patients 65 and older.
The community has been really excited. We actually were outside yesterday bringing boxes in, and we had two young ladies come over and were really interested in asking what it was and asking if they could come for a tour that day. So yeah, I mean, we've had a lot of calls. So it's been really a great reception. You know, it's a senior-focused primary care clinic, which, you know, encompasses our wellness and social activities, which is including group activities for chair yoga, one-on-one fitness assessments, but we also understand that loneliness in the senior population is one of the unnoticed or maybe unrecognized issues. And so we have put together a program that allows for patients to come in and socialize.
The facility is also offering traditional care services at the clinic.
So we're also offering a one-stop shop for clinical care. So we have our primary care physicians. Now, each of our providers have a smaller number of patients. The traditional primary care provider has about 1,500 to 2,000 patients. And our providers only see up to 450 patients. That allows them to see our patients for longer periods of time during the visit. 60 minutes is our typical visit.
And be able to take that time with patients, and you know, just gives you the opportunity to be able to practice good preventative medicine. You have time to talk about the family, you have time to talk about all the other things that sometimes in a rushed office you don't have time to sit down and discuss what's going on with their family, which a lot of times has a lot to do with what's going on with them medically.
We will do x-rays of which we can read here before they leave. And then the other capability we have is telemedicine, which the patient can actually sit in front of a monitor with their PCP, and we could have a visit with a specialist. So if they're worried about anything neurologically, from an ortho perspective, we can sit down with them, and there can be that visit with the specialist.
And we all sit close together, and we coordinate the patient's care. Even when they're not in the clinic, we're talking about them and trying to keep them healthy. And that's the biggest part of it is we want to try and practice good preventative medicine and keep people healthy, keep people out of the hospitals, keep them out of the emergency rooms. Nobody wants to go there.
Right.
So our hopes are that we can provide that care here and try and keep them from having to be hospitalized or